Grandview Hospital is a small, about 200-bed community hospital in Sellersville, Pennsylvania. I think we were hit significantly for a community hospital. Like at some point, we hit something like 20 or 30% of the hospital was COVID.
Around the shutdown in March of 2020, we immediately made a decision as an organization to never close our doors to patients.
We recognized, I'd say late November, early December, that monoclonal antibodies were something we could begin to offer to patients. But of course, we had to develop a plan for how to do that.
I do remember there being an announcement that, there's monoclonal antibodies. They're going to be available by EUA. And it was kind of like, how are we going to do this? COVID's here and we're having our own staff get affected by it. And so our biggest issue is, how do we get this to the patients?
We, in general pharmacy, we have a very good relationship with infectious disease. So obviously when COVID comes on the scene, one of the things that we realized was we need to come up with a protocol.
Providers feeling like, I need to learn something new, and how can I do this? How can I set up a new workflow for something I've never done? Primary care providers are not used to ordering IV infusion treatments. These are things that you've never asked a primary care provider to do before.
We talked in small group session, refined the protocol in a way that worked for us, and then went back to our individual offices and said, we need to be the arbiters of this. And everyone, was pushed to try one and then encourage their friends, hey, it's not as hard as you think, and patients are getting better. Identifying a patient who might be eligible either by risk or time frame. And then it's talking to the patient about, hey, I have this option. It's a newer treatment. Here are some of the particulars. We are fortunate enough to have a partnership with our community hospital where you might be able to receive this. I will say, once a patient came back and said, yes, I'm interested, I never had an experience where it took more than an hour for me to hear back from the pharmacy staff at the hospital saying, this person is approved and they will be treated either today or tomorrow.
Everything was time sensitive. Once we created a process for this, we didn't know if we were going to be getting 5 people who needed this or 50 or 100. We had no idea. First hurdle for us was, okay, we got to figure out which patients qualify.
The time barrier is critical. Feeling like you as a provider have time to answer questions, that patients can really think it through.
Once they're approved, we then place the order, get the label, we send it into our IV room. The IV room prepares it for the patient, and we send it down to the short procedure unit to get the infusion.
I think once you walk into the halls of a hospital, it's a little bit more old school. People like paper and written things. There's certain sets of rules and a pace of things, and it tends to be a little bit slower. It was just incredibly collaborative to have these meetings where so many different people can weigh in on, here's what my side of the world looks like. And then we start kind of building these bridges from one department to another.
Being able to go back to hospital pharmacy, talk about, is there anything else we can do to try to ease the burden on the primary care providers? And it worked out very well having the 2 different sites available, not only for providers, but also for patients, because our community is such that our patients are really spread out. And so for some people, even just going to an urgent care, that maybe they could go to an infusion center that was only 5 minutes from their house instead of, for example, 20 minutes.
It's really amazing to work with a group of people that all want the best for patients. And nobody at any point in time said, I can't do that. That's not going to work. They might have problems or issues, but they're always willing to work together to figure out another way or a better way.
I think what was really nice is we have spent a lot of time behind the scenes building up a rapport between our primary care base and our local community hospital. If that relationship had not been nurtured before this crisis, I don't believe that we would have been able to act so cohesively.
By really throwing out the rule book and just building kind of a 21st century way of dealing with it, I think that really showed us that if you have enough people on board who want to make something happen, you can do it. You can absolutely do it. You just need enough people with skin in the game and a motivation and power to do it, and that's it.